Welcome everyone, my name is Márk Pavlekovics and this is my PhD thesis. So about the Myasthenia Gravis, NMOSD and anti-MOG disease. This topic was chosen because I work as a neurologist at Department of Neurology at Jahn Ferenc Hospital. What my vision? I visualize the personalized therapies based on evidences and well-organized patient care system for patients with neuroimmune disorders. My mission is to reach this goal via introducing an up-to-date decision support tools for doctors in all regions of Hungary with well-designed registry-based platform. These are my topics. Let's see in detail. My first topic is a systematic review and meta-analysis about the efficacy and safety of plasma exchange versus intravenous immunoglobulin in moderate to severe myasthenia gravis relapse. So why it is an important, what is the background? The moderate to severe MG relapse might progress into the respiratory crisis that has a high mortality rate. In first crisis is around 3 to 5%. At second crisis increases this number 5 times bigger figure. The currently used rescue intervention to prevent progression into the crisis, either IVG or PLEX. Both options have some weaknesses. IVG production is so expensive and currently there is a shortage of IVG supply. PLEX is not available everywhere and it's required a profession nurses. So, which one is better? Which one to choose if you want to prevent the progression? Are there any differences? Should one prefer one over the other? We don't know the questions. We have to find the answers with our meta-analysis for this, and we hope this will lead to the decreased number of deaths. What this study may add? The clinician should know whether they are interchangeable and which is preferable in the given situation. So our aim is to compare the efficacy and safety of these interventions. Our question is about this: what is the efficacy and safety of these methods? And our PICO framework shows the outcomes, which is the changes in quantitative myasthenia gravis score. This is a severity score which reflects the changes in patient status, and the other outcomes is the adverse events. We hypothesize that PLEX is superior to IVG in terms of efficacy and safety in patients with moderate to severe myasthenia gravis. And what is our clinical implication? We hope it will help the clinicians to choose the most efficient and safe therapy for the patients. We conducted our research in 5 databases with this search key. Now we found 5 eligible full text, and now we are in the data extraction phase. Let's see another topic of mine. This is organizing and building the Hungarian myasthenia registry. Myasthenia is the most common autoimmune disorders that affect the neuromuscular junction. In Hungary, more than 1,500 patients suffered from this disease. There are some existing and ongoing registries in this territory, such as MSBase and EuroMG, but in Hungary had not been established. So why we think we are in a good position to do this, because more than 60% of patients with myasthenia gravis are treated at our department, so we will be a good cornerstone, we hope. What are our aims and main goals? Our main goals to create epidemiological landscape, and of course the registry for the uniform MG visit and treatment plans, and for the easier patient follow-up. About the registry resources, I would like to emphasize the financial resources, the fiscal part is covered by MONIT, which is the Neuroimmun Society, and the data collection will be by the softwares. So this is our plan, to avoid the double data entry by the software. Of course, at the beginning, we have to work with registration, with the person who will register the data. We planned the pilot part in our hospital. It's 2 years story, and after that we want to involve other hospitals. Eligibility criteria are done, so we hope we can start our project as soon as possible. And this is my third topic. This is a registry project, not an initiating. We would like to update the NMOSD and the MOG-AD registry. It was an ongoing registry, but it was interrupted. So our aim is to upload patients' data and create up-to-date epidemiological landscape. These are my specific goals again, and the planned submission dates. And let me finish my talk with a quote: "Your best teacher is your last mistake." Thank you for your attention.
Congratulations. I wanted to ask that in myasthenic crisis, in our practice we combine EVIG and the other strategy. So what is your in practice?
So the question is related to, are we use together these?
Yeah, absolutely.
No, we use these options separately. It could say not randomly, but there is no gold standard. So if we have enough IVG, we will use this. Sometimes we use Plex. This is the question, which one to use first.
If your registry is supported by the MONIT, okay, then can you make it a nationwide registry? Because even though you treat 60% of your patients, but this is not representative at the end of the day, is it?
I can't answer this question now, so we hope we can. It could be a nationwide registry, and we would like to involve, of course, every neuroimmun centers.
Okay.